Thank you for listening to another episode of Disrupt HealthTech. I am your host, Wendy Austin, and today we're going to disrupt tech for your health. I have Kristin Kneedler, the CEO of Counselors Associates Ltd, and we are going to discuss how being always on and tuned into your electronic devices is affecting your health. First, let me introduce our guest, Kristin Kneedler. Kristin is the founder and executive director of Counselors Associates Ltd. She specializes in treating healthcare professionals, first responders, and post-traumatic stress disorder and trauma. She works with her clients on a variety of issues, including resolving and managing workplace burnout, resolving the negative effects of trauma. She has multiple licenses and certifications for psychology and counseling and is a nationally board certified counselor. Welcome, Kristin, to Disrupt Health Tech. Let's get started.
Hi, Wendy. Thank you for having me.
Thank you. Let's dive into how electronics affects mental health and what the effect of never turning off is.
Okay, it's a broad, big subject. Mental health itself is such a big construct and subject. But when you throw electronics in there and how they affect mental health, we start to recognize that as beings, we really were not built for electronics. Something so simple as the bright colors, the blue light that's being emitted from the electronics, even the radio waves impact our bodies. And the time spent on electronics has gone up exponentially over the last 10 years.
Yeah, that's true.
Yeah. And so when we look at the interface between mental health and electronics, we recognize that there is a strong benefit to mental health from electronics. There's also a pretty strongly linked detriment.
Yeah.
So the detriment is one of the first ones that I always like to look at and speak with patients and parents and schools about is sleep.
Oh, yeah.
Yeah. So the blue light that is emitted before we go to sleep impacts our circadian rhythm. It impacts the ocular nerves in the eyes, and it confuses our bodies. So then our body doesn't release melatonin properly, which impacts the circadian rhythms in our sleep. And I might nerd out on you here. I get so excited about brain development and neurons and neuroplasticity and the interplay between synapses in the brain. And what all of those words combine to mean is electronics impact our brain function.
Yeah.
And so they impact our sleep, which is a major component of our brain function. And there is a really simple way I like to describe what happens when we sleep. These tiny little cells wake up when we go to sleep. They're called glial cells. And the glial cells kind of chomp through our brain while we're sleeping, collecting all the garbage and all of the discharge that our brain creates throughout the day when it's having thoughts, when it's seeing visual images, when it's experiencing an emotion. And so all of the experiences of the day create tiny little pieces of trash or garbage or byproducts within the brain. And when we're asleep, the glial cells chew up all of those byproducts, and then we start fresh in the morning with a fresh brain, except for when we don't.
Yes. Yeah.
Because of the electronics.
Very good. I've also heard too that sleep helps to store memories into long-term memories, that they're kind of going back through your day and storing them in the long-term memory too. So I know that there's issues with that when you can't get enough sleep.
Absolutely. I mean, and that's part of that whole systemic process with the glial cells. If there's trash blocking the neural pathways and the synapses from connecting, that trash is blocking your long-term memories from being able to be consolidated within the brain systems.
Yeah. Very
Great
good
point.
So I know you work a lot with clients who are suffering from burnout, including healthcare professionals. How do you feel the always on behavior affects them?
I would say that always being on definitely can cause burnout for any person in any industry at any age.
Yeah.
We can sometimes even see this with kids in sports, that doesn't necessarily have to do with electronics, but When you're doing anything too much, too long, too often,
Yeah.
and not having breaks, it just isn't beneficial for the brain development. It's not beneficial for relationships. It's not beneficial for your emotions.
Yeah.
So having boundaries is something that we talk about a lot regarding burnout and being on,
Yeah.
whether it's in electronics or in other ways. And so having boundaries, time boundaries, physical
Yeah.
boundaries, no phones in the bedroom,
Yeah.
no electronics in the bedroom, things like that.
Yeah.
Mhm.
Just in particular because, I have a lot of people that are in the healthcare industry, and burnout is a huge problem in that industry. What are some of the tips that you might have for the physicians in particular, or the healthcare workers that are experiencing burnout?
Number one, I would say go back to the basics. Are you drinking enough water?
Yeah.
Are you getting enough sleep?
Yeah.
Are you playing?
Yeah.
Are you reading for enjoyment? Are you
Right.
exercising in an enjoyable way?
Right.
And what are your relationships looking like? Are you making eye contact with other people and engaging in physical touch, even if it's a high five?
Right.
Um, so go back to the basics. Think about physicians 50 and 60 years ago. They were not researching all night
Oh,
on their
that's true.
computer about cases.
Right.
They went home to their families. They went on walks. Um,
Yeah. Very
so,
good.
mhm.
All right. So, we all know that electronics makes our lives easier. You just talked about researching cases and working at WebMD. One of the aspects was like continued medical education. So I know they are often at midnight taking those courses rather than during the day. But is there a balance there between digital interaction and human interaction? And, how do you recommend that people strike that balance?
I think the balance looks very different for all people, and it can look very different for the same person any given week.
Okay.
So I think recognizing and listing out your own signs and symptoms of burnout, some of those signs are irritability, cynicism,
Yeah.
um, displeasure, the list goes on. So listing out your personal signs and symptoms that you might be feeling burnt out, and then having an action list of things to do when you start to recognize those symptoms rising to the surface,
Yeah.
and simply follow the list. You'd be surprised at how many people will get stuck in a loop in thought in their mind or scrolling. And if they would just throw that phone or put it down and get up and walk outside, how impactful that can be to kind of reset.
Yeah. Yeah. Um, yes, I totally. I have the same thing, but with like the bingeable television episodes of, oh, let's just watch the next one. Let's just watch the next one. All right. So,
Same.
yeah. So let's pivot and talk about the pandemic and how that's changed work and school life in particular, and how people are dealing with integrating back into the workplace or back into the school environment. So,
Mhm.
do you think overall people are ready to go back into the workplace full time? There's been quite a bit of press around, employees resisting going back in.
Mhm. That's an interesting topic because for some people, being out and working remotely has been profoundly beneficial.
Yeah.
It has helped their relationships. It has improved family dynamics. It has allowed for vacationing or travel. It has been more flexible, where maybe a person might wake up in the morning, be able to take their children to school and have that one on one time together, and then go do their work,
Yeah.
maybe meet someone for a lunch date that they wouldn't have been able to do if they were in the office. And so for some, and on, right? So some people, it is extremely beneficial, and they absolutely feel that their quality of life has increased, and they would not give it up for anything to
Right.
keep it the way it is now.
Right.
Um, they didn't know what they didn't know when it wasn't an option.
Yeah.
But then you have the other side of the coin where, some people, it opened up the option for them to isolate.
Yeah.
It really fed into depression and fed
Yeah.
into social anxiety. And it deepened those neural pathways of avoidance of the world,
Yeah.
avoidance of others, avoidance of even the self.
Yeah.
And so for those people, the pandemic has really been a super negative shift
Yeah.
to where now they're afraid to go out, or they find so much comfort and solace within the walls of their home. They're starting to develop agoraphobia.
Yeah.
They have forgotten how or feel fearful of social interactions and are avoiding that at all costs. So, I think that people reintegrating after the pandemic, we're solidly a year into reintegrating, I would say,
Yeah.
to some degree for a lot of people. I mean, there are still a lot of office buildings with thousands of employees shut down and selling and keeping people remote. But I think it is a matter of people finding their balance from that pendulum swing. And I think some people, now that everything's opened back up,
Yeah.
are going just absolutely too extreme and going on vacations and saying yes to every outing and every
Yeah.
activity, going out to eat all the
Yeah.
time,
Yeah.
you know. So, they felt like they were so deprived of activities that they were once used to, and having to order things on websites
Yeah.
instead of going to stores.
Yeah.
I think that, that's also lending itself possibly to more debt and more stress. Keeping up with the Joneses goes back to comparison on the
Yeah.
internet and on social media.
Yeah. Yeah.
It's a big bull mixture of a lot of factors. And when someone is able to kind of sit in with themselves, or even take out a notebook and write out all these things and start to organize them and straighten them out and see kind of what's going on, they can start to recognize, okay, I'm adding more stress to my life
Yeah.
because I'm pendulum swinging here. I'm doing too many things. I need to slow down and pace myself.
Yeah.
Or someone might recognize, oh, wow, before the pandemic, I was out of the house about 10 times a week. Now I barely leave the house once a week.
Yeah.
Let's look at that and see if that's impacting our mental health.
Yeah. It is really going back to talking about balance, and really trying to find that balance for yourself. I'd imagine it's individual for every person.
Yeah, it really is individual for every person, and it can be different for one person from day to day, from week to
Yeah.
week.
Yeah. Very good. Let's talk about the children and going back to school. Have you seen a lot of issues with, I would think, this is my own thought, but that younger children who started their school life in the pandemic and knew nothing but, socializing via a digital camera and what we're doing today, and their classmates trying to go into a full school setting.
Well, I mean, absolutely. I think you're onto something there. These kids have had so much more time, intimate connection time with their parents than the
Yeah.
average child who's not a pandemic child or young child.
Yeah.
And some of these kids, if they're 3, 4, 5, 6, sometimes even 7, they have no core memories and no memories
Yeah.
even pre-pandemic. And so to them, that was normal. And now this is abnormal.
Yeah.
And so establishing that this is actually how it's supposed to be is kind of a jolt to the mind for these younger children. And I think overall, though, ultimately we are social beings.
Yeah.
And we want to be physically present with others.
Yeah.
And so I think for most children, it's been really, really beneficial to integrate back into the schools. But you do have a bigger majority of children, not the majority, but of the minority, that are scared and feel nervous and have that social anxiety or that medical anxiety of exposure to germs and things like that.
Yeah.
So I think for kids reintegrating into school, our teachers have a much loftier, much more difficult role with all of this than they did before the pandemic.
Yeah.
And And I think the kids having the vocabulary, the understanding of how to verbalize their feelings can be highly beneficial to the entire classroom, the teacher, the parents, to recognize what's going on.
Yeah. Yeah, that's true. All right. So, going back to healthcare professionals, we saw a huge pivot during the pandemic to telemedicine and virtual doctor visits. You know, some people, they like that digital interface, especially when it comes to medical and healthcare visits, right? So, you know, and there's some patients that like, of course, the human interaction and being able to, talk to the doctor face to face and everything. You know, can you share how this might affect healthcare workers in general and or patients on either side of that in terms of, the patients that only want to see their doctor digitally or, only ever want to see the doctors in the office?
Mhm. Well, I think for doctors or providers who have mostly patients who want to see them online,
Yeah,
I am hoping that that doctor or provider has been able to select that because that too is what they desire.
I see. Yes. Yeah.
Because if you have a mismatch of a provider who would prefer to be in person and their employer is really requiring them to do the majority of their work online,
Yeah.
that can be profoundly dragging and depleting for that provider and could really lead to very quick burnout.
Yeah.
The reverse is also true. If it is a provider that thoroughly enjoys the online process and has much more comfortability and much more enjoyment of maybe seeing, for instance, I'm looking at you. I don't know if the listeners would be able to see this, but you have some beautiful plants in the background.
Right.
And
Thank you.
me seeing that is making me happy to see a little piece of who you are and that you
Right.
like plants. And I'm thinking of the oxygen that they're cleaning in your room and how great that is for you. And, that brought me a little spark of joy, a little glimmer.
Yeah.
And I think for some providers, seeing that
Oh, yeah.
and seeing their patients in their normal home habitat or
Right.
that natural environment is kind of neat for the provider and makes them feel even more connected to their patient.
Right. Oh, that's very good. I hadn't even thought about that. Very good.
Sure. I was going to say, and then for the providers who really enjoy that in-person interaction and for the patients who enjoy the in-person interaction, there is something to be said about the warmness of a human interaction in person where you feel the energy of the person next to you. And, there are some subtle signs and shifts in body posture or breathing patterns that you may not notice in a online encounter. And so that can be more intimate.
Yeah.
So it really is about balance, and it's about what does that individual person truly enjoy and what is most beneficial for them. So I would love to see, there is some talk within the insurance community about ending the COVID measures for telehealth and teletherapy in December of 2024.
Yeah.
And I would love to see some major legislation go through to eliminate that because it has just really opened up an entire avenue of benefit for those who enjoy that medium.
All right. So, in closing, is there anything that you would like to finish with or suggestions on how to have that balance that we've talked about, especially when it comes to digital technology?
I think when it comes to digital technology, having boundaries, having time limits, having a family member or a friend set an alarm or a boundary on those apps that you get addicted to or spend too much time on where you don't know the password, where it shuts off after so many minutes, setting time within your day to be out in nature and outside, let the natural sunlight hit the retina in your eyes to help with those circadian rhythms. Even 1 hour going to bed 1 hour later at night can profoundly impact someone's brain functioning.
Yeah.
So sticking to a regular sleep routine, I would say, is beneficial. And just number one, ask the people around you. We aren't living on an island. We're not isolated. We live in community in relation to others. And if someone around you, you ask them sincerely, Am I using digital means too often? Is it impacting me in a negative way? What are your genuine thoughts? If they say yes, then start to make an action plan to change it
Yeah.
and see how much better you feel and how much more engaging you are in your own life.
So if someone wanted to reduce the amount of being on digital or electronic devices, what would be the one tip that you would ask them to do?
Don't turn it on until noon if you're able to.
Yeah.
Don't, if you turn it on, every morning at 6 a.m., 7 a.m., 8 a.m., turn it on 1 hour later. There, you've saved
Oh, there
1
you
hour
go.
every
Yeah.
day. That's 7 hours a week. That's 30 to 31 hours a month. Start there. Start little.
Yeah. Very good. All right. So thank you so much for your time today, Kristin. I really enjoyed discussing using tech responsibly for your health. And for more information about either Disrupt HealthTech or Counselors Associates Ltd, please see the links below. Thank you so much for attending today, and see you next episode.
Thank you so much, Wendy.
Thanks for tuning in to Disrupt HealthTech. We hope you found our conversation today inspiring and informative. Remember, the key to success is using technology in an innovative way to improve healthcare experiences and patient outcomes. So keep a lookout for ways to challenge the status quo and keep innovating. See you next episode.